See, this session is going to be an interactive session, and your participation is at most important to take it forward. Okay. So, can you briefly introduce yourself so that from which specialty into and what is that you have completed so far, and so what is your designation and position working right now? So that based on that, so you'll be able to tailor your uh, requirements. So this is going to be an introductory program for first day of 3 hours, but a faculty training program does not get completed in a day. So this will give you an outlook on what all to be done, and you will have two more sessions on Sunday, coming Sundays, where I'll give you some exercise for you to do and to present to me and to get back to you on the first feedback, and then to correct it and get back to the second feedback, and so that you get into the flow of what is required for a teaching for competitive entrance exam. So can we get to know? So let me introduce myself. By the time you can type, or you can type in my personal WhatsApp also if you don't want to do it in chat. My number is 98400 44686. You can do it in my number for contact 98400 44686. You can type it in the chat box also, and so that they can send me a personal message so that I'll be able to look into it. So, myself, Dr. Vinayak Senthil, I'm a cardiovascular and a thoracic surgeon, and I did my MBBS in Government Kilpauk Medical College and DNB General Surgery in Government Kilpauk Medical College, and MRCS in Royal College of Surgeons, Edinburgh, and then MCH Cardiovascular and Thoracic Surgery in Madras Medical College, Chennai, and various fellowships program across the globe and in India. So, this is in short about my educational qualification in the medical career. Okay, so to start from MBBS to finish till super specialty with all fellowships and trainings and observerships and across the globe that is required for that particular specialty. Is that what I have done? Okay. So training process. What I want to tell you is my teaching career started when I was in the first year of my MBBS. So are you able to connect? I mean, if you can chat with me, it'll be really great that I could know you're following me. Aravind?
Hi, sir. Good morning, sir.
Hi, good morning. How are you?
Yeah, I'm good, sir.
So where are you calling from and where are you right now? Can you just give a brief introduction about yourself?
Yes, sir. I'm calling from Kerala,
Okay.
Trivandrum.
Okay.
I'm doing my MD Pediatrics second year, sir.
Okay. So
Mm.
great. And MBBS from which college?
So from JNMC Belgaum.
Oh, JNMC Belgaum. Oh, excellent. I mean, I've been to that college somewhere between 2010 and 11 and 12
Oh, really?
to take classes for the students who are there for PG entrance examination.
Oh, okay.
So your keen interest is to for train the students for a competitive entrance exam like upcoming next exam.
Yes, sir. I
Okay.
have.
So what really motivated you to do so? I mean, is a passion to teach? Is it an avenue to do that so, or you had? We're looking for this for a long time.
So, in fact, from my schooling days, I was so much interested in teaching, and because I used to get quite a good response after all those classes that I take, so that boosted the confidence and somehow like
Okay.
so I wanted to take a clinical branch in so that I can teach as well as some practice.
Hmm. Okay. Very good. Excellent to have you on board because this passion is what is more important because the kind of satisfaction derived out of training students and not only training, and it becomes very productive when they score and be successful because of that.
Yes.
And that gives a great amount of satisfaction that is equivalent to treating a patient and curing a patient and sending them, discharging them home.
Yes.
So very, very nice. And pediatrics is a great specialty. And so, I mean, I could understand. And with that connect, because I need to get connected with you. Basically, this teaching program is nothing to do with the presentation or nothing to do with the
Mm.
point, nothing to do with the writing. It is to connect the mind actually. So you should get connected to the mind of the people who are attending to you. That's very important. You should know what they are up to and what they want actually. So without that, you cannot deliver what they wanted actually.
Okay.
So that is a very first step. So you can't just start a lecture without knowing whom you are teaching.
Mm.
And same time, the people who are attending you also should know whom you are. That's very, very important. So this brief introduction will make a huge difference.
Yes, sir.
Okay. So can we know about Dr. Kishore?
Yes, my name is Dr. Kishore and I'm speaking from Surat, Gujarat.
Okay. Okay.
And I am basically by qualification a pathologist,
Okay.
and I completed my MD from Solapur, Maharashtra.
Okay.
And that happened in 1990. So I'm pretty senior.
Okay.
And then in a very brief way, let me tell you, I went to the US
Okay.
for research because I was involved in cancer research and a little bit of interventional cardiology based research.
Okay.
And in the US, I completed my USMLE exams.
Okay.
And I got into dermatopathology in Johns Hopkins
Okay.
University.
Okay.
But I could not complete that because I had to come back to India for some family issues.
Okay.
But teaching has been my passion, and when I came back, my colleagues and their children, they wanted me to coach them for
Okay.
USMLE because there was no real one-on-one coaching for USMLE at that point of time. This was
Okay.
around 2012.
Okay.
And since then, I have been coaching students for USMLE and for PLAB
Okay.
and for the Australian Medical Council students.
Okay.
So it's been a very rich experience because USMLE is a very complex examination.
Yeah.
It requires a lot of interdisciplinary reasoning and clinical reasoning and so
Okay.
many things. So I got thinking, I have excellent results with my students. They get into good residency positions
Okay.
in US. So I am the only teacher right now in my company as such.
Okay.
And there have been a lot of inquiries that keep coming for all kinds of exams.
Okay.
And obviously next PG or all these things,
Okay.
they are a continuation because next PG is now structured along the lines of USMLE.
Correct. Correct. Exactly. Exactly.
So it makes a lot of sense because I understood that USMLE also is a lot of managing psychology, student psychology. It's also a lot about understanding the patterns that are created when they ask certain MCQs. So it's about pattern recognition. So many interesting things that have come out of this educational process for me. And
Exactly.
perhaps the most important reason for me to join this webinar today was my nephew. His name is Chinmay, who is currently your student for NEET SS
Okay. Okay.
in surgery. His name is
Okay.
Chinmay Managoli, and
Okay.
he's one of your students. So he gave me very high recommendations about you. So I wanted to, if not in person, virtually, I wanted to meet you. So here I am, and thanks a lot for letting
Yeah,
me
I
talk.
was also thinking you have a rich experience in this line. I mean, what am I
Yes,
going to add on to it?
yes.
Anyway,
Yes.
I mean, it's nice to know, but because there is a slight difference
Yeah.
between the US AMLE and PLAB and Indian exams.
Yes. Yeah.
The line is thick, not thin actually. The line is very
It
thick.
is. It is. Yeah, absolutely.
So
Yeah.
definitely I will be able to give you an input regarding
Yeah.
the mindset of the examiners. How do they pick up the questions, and
Yes.
in what in mindset they are in right now, and how they approach the standard textbooks into converting them into a multiple choice, and
Right.
what is all required. So I mean that we will cover one by one.
That's very
Okay.
interesting.
See, this session is not I'm going to teach you anything. This session I'm going to share my experiences of teaching with all of you. So that could give you a lot of input in kind of fine tuning your teaching skills. So initially what I asked them to is to go into the app because there are a lot of questions and videos are there. So simulations and modules can be done over there. That's the reason why I asked you to log on to the app, and also I've given rest of the participants to come into the Zoom link directly also. And so what I have gone through is I have gone through the exams, competitive exams that are in India, and those competitive exams across the globe. So in my experience, preparing for competitive entrance examination is totally a different ball game altogether. So it's totally different ball game altogether, and it is nothing to do with the knowledge in place, and the students who are good at their subject may not be able to do well in the competitive exam. So it gives a sense of demoralization to the students that I have read the subject well, I have known the subject well, still I have not been successful in the entrance exam. So first, to understand about an entrance exam, how is it different from the theory exam and from the competitive entrance exam? The difference is the theory exam is a game that is set in a way that you want to play. That means a student can write what he wants and what is there in the mind. But in a competitive entrance examination, it's a set game. That means the examiner will set a game for you so that you have to play in an examiner's perspective. So it is not that like in a theory exam that someone can do what they wanted. But in the case of a competitive entrance examination, the set game, that you need to know what exactly is expected out of you for the answer. In that, the 4 options or the 5 options which are given there or has a relation with the question. And this question and answers, they are related to each other very closely. And in that 4, what is the very close relation to the question becomes an answer. And the other part of the question is the negative way of asking question. One way is the positive way of asking question. The other way is the negative way of asking question. The negative way of asking, I'll just show some of the questions after I discuss this. The negative way of asking question is, which is not at all related to this question. Yes, that becomes an except. All the following are associated with this except. So, which is not at all related out of this system. So, now, if you ask me, is preparing for an entrance examination, there's a question asked by my parent, one of the parent of the student. He asked me, sir, the question is given, answer is also given. What is the difficulty for a student to match this option to the question? I mean, in a theory exam, at least you need to write a lot of things and you need to cover up a lot of things. But in this entrance examination, both the question and answer are together. Why are the students finding it difficult to match to the question? I said, that's the most difficult thing, because all these 4 options are related to the question, and which is very closely related to it is what is very, very important. And all the 4 out of that, one will be closely related, other will be a differential diagnosis for what is related. So point number 1, if you ask me, what is the most important requirement? If you ask me the most important requirement of a student, number 1, he has to have a passion. That is one part, to do something. So you need to get the right student. Number 2, for a faculty, what is the most important requirement? The most important requirement for the faculty is a thorough knowledge on the subject. That means it has to be updated onto the standard textbook. If I am teaching surgery, if the Bailey 28th edition book has been released, then I have to carry with that book with me. This is how it has to be. Suppose Nelson latest edition of book that has come, then you have to be with the Nelson in case you want to teach for competitive entrance examination. And suppose pathology is taken and Dr. Kishore want to do, he has to have the latest edition of Robbins with him always. That means for a teacher, other than the time that he teaches, other than the time that he involves in the clinical practice for a doctor, the rest of the time is non-productive. See, that's how I look at it. See, other than the time I operate and rest of the time, even in the change room, when I am in the change room, that change room time is a non-productive time for me. So my mind 100% works today with you, today to teach you something, to deliver something to you. And other than that, I treat a patient, I do a surgery, and after that, rest of the time is non-productive. That means, I could have food, I could do something, but those are not considered professionally non-productive. Those professionally non-productive, the teacher should carry the latest edition of standard textbook along with them, what they intend to teach. This is my first recommendation. That means non-productive hours. For example, I'll tell you, yesterday I was attending a conference in Coimbatore, Indian Association of Cardiothoracic Surgeons. The flight was delayed by 45 minutes. And immediately I took out the book which I had, yes, from the bag, and I started reading. And in case, if I don't carry a book, I carry the e-book or the PDF file in my phone. I open up and I read. At that time, I utilize to make some questions. That time I utilize to look into how can fine-tune my knowledge in the subject, because people who listen to you, and especially medical students or medical doctors, they have quite amount of good knowledge they have acquired, and they will be there with you to listen to you, and you could impress them, and you can hold them only if you are more intelligent than enough. It's nothing the question of intelligence, it is a question of how smart you are. That means we need to tell them something that they don't know. See, to this lecture today, you are there with me. If I tell you something which you know already, this lecture will not be interesting at all. This workshop will not be interesting at all. I need to teach you something that you don't know. So this has to be there in every class. You understand this? This has to be there in every session of yours. That means today you take a class, suppose in gallbladder, if suppose the same gallbladder class you take to the same audience next after 1.5 months or even in the revision, that class has to be totally different from what you have taken in the previous class. That means the student has to learn something new from you that they have not known. That's very, very important. So for this, precise and a complete and exhaustive and a precise knowledge of the subject according to the latest edition of book is very important. What is the latest edition released? It is not that I have read Nelson during my MBBS days. For convenience, I follow. That doesn't work that way, because the data, the numbers, because this the precise value which changed is only asked in entrance exam. That you need to understand that. What is being changed from the previous edition of books to this edition of books, of suppose say 15 questions are asked in pediatrics. Pathology applied now for the next edition, applied pathology, if suppose. It is only the changes that are getting incorporated in every exam. Yes. So whatever the changes in the recent advances, what are the changes in the management, only those gets updated in the subsequent exam. So those changes, they are trying to understand. See, there are certain set points. Suppose there are 200 questions in an exam. Out of the 200 questions, 100 questions will be fillers. That means 50% of the paper will be a filler. That means that is known to everyone. So that will not decide outcome of the exam. Another 50% of the question, you should understand, another 50% of the question will be, 25% will be really difficult, that very difficult to attend. Another 25 will be logic between two answers or two options. Which one to choose? So I will just repeat this once again for your benefit. See, what I'm trying to tell you is, in a given paper, suppose 200 questions, okay? Out of that, 100 questions, it's called filler. Yes, next 50 questions will have a logic between to choose among two options. Another 50 questions are the real tough ones, that I mean out of the box, newer advances, updates. So, and things which are not a student can reach by himself. Now, if you ask me, which will decide a ranking in entrance exam, you should understand. This filler, 100 question of a filler will not determine the ranking for an exam. The out of the box question, very difficult, tough questions will not determine the exam, the outcome of the exam. This 50 questions to choose between two options, you would have been filtered. Of the 4, 2 would have been filtered. The other 2 is very difficult to filter. And in other words, which I can tell you in simple words, A is all the students to attend. That means all the students are familiar with that question, with all the 4 options. They can read, understand, and answer. That means they are called easy ones, easy questions. B, they know 50% of that question, 50% they don't know. That means they're able to filter 2 options in that. Next 2, they know, but they're not able to differentiate within that 2. So that is going to what is decided in the entrance exam. Qualification of an entrance is that what the option B is going to decide. Option C is totally difficult. It is totally difficult and it is purposefully set, yes, for the students not to touch and not to answer. And this they should understand. And if there is a negative mark in the exam, they should leave these questions. And 50 you cannot leave, and it will not be a qualifying. But if you want to leave, so the student should understand, see, if I want to leave some question, I need to leave the questions which are there in the tougher part. I should not leave a question which is at the easier part of the, that means what I'm trying to tell you is A and B, students should not at all leave the question. They should definitely attempt. That means in a 200 question, 150 questions is a must to attend. And another 50 questions are going to be tougher ones and need to crack it. And in case out of that, you need to take a risk. If somebody is taking to do a risk, what do you mean by a risk? In the tougher ones, if you can answer as many as possible, then it's that you answer taking a risk. Very clear? So what I'm trying to tell you is now, you can ask me a question. Sir, you said 100 questions is the filler. Yes, 100 questions is a filler. That means you go for a meal. You go for a full meal. In a full meal, they give vegetables. Yes, typical South Indian meals I'm talking about. They give vegetables, they give a pickle, they give a sweet. Yes, and they give a chapati or a puri, and they can serve you the rice. Now, try to understand, then they can have dal, they can have rasam, they can have curd and all that. See, in the entire meal, if you look into the entire meal, this 100 question comes under the rice or the chapati or roti. That's the filler. You understand that? Yes? You tell me, without that filler, you cannot have a meal. Correct? You can't have a meal. So you need to have a filler. See, if you go to a place in a hotel, if you ask something and order something, they give you a very less quantity, but it's of good taste. And you will taste it and you want it more. And you have to pay for it and want to ask that to have more. You feel, what this fellow, though it is tasty, but still they're not giving me an adequate quantity. I'm not, fully satisfied, though the quality of food is very good. That means for that, you can't keep on asking. See, that's how it is about. That means the exam is all about that. They can't give you the quality questions for the entire paper, because if the entire paper is like that of C, the student cannot attend the paper. At the end of the day, he'll come out of the exam and say, what kind of exam is this? And I don't know how to attend this exam. And it's totally out of what I have prepared. So they will lose confidence in the exam. So the very purpose of giving this filler is to everybody to attend. That means, see, examination, any examination board wanted more students for their exam. Understand this. Let it be an Indian exam, let it be an overseas exam. They want more participants for that exam. Of course, because of the exam, they're going to get a benefit of a seat. That is different. But any examination board want to have more. And it has to cater. See, exam is also to catering to the needs of the student. So it has to cater, it has to satisfy students by and large. In that, you need a filler. So talking about the filler here, 100 question, I said an easy question, and that everybody should attend. It's a must-know question. That means this has to be known to all the participants of the entrance exam. Any entrance examination, this 100 question is the basic that everybody should know to attend. Finish. But I said that will not decide the ranking in the entrance. Am I right? That's what I said. It will not decide the outcome of the exam. In what way? If a student attends all the 100 questions right, if the student answers all the 100 questions right, yes, it will not matter the outcome of the exam, but it will help him to stay in the exam. That's very important. Staying in the competition is a key. That means if a student has to stay in the competition, that means I need to fight on 1,50,000 of doctors who are writing for this NEET PG exam or a next exam. I have to be in the competition. So to be in the competition, filler has to be answered correctly. Now, if you ask me the other way around, sir, what if a filler is made a mistake? One question, I'm just in 100 question, I made a filler here. This 100 question, one question I made a mistake of the filler. One question. That means one easy question. That means one of the easiest questions can be asked is the most common type of malignant melanoma. Suppose they ask you this. Leave alone that. If they suppose that somebody is going to ask you, what is the most common type of skin cancer? If somebody is going to ask you, yes, what is the most common type of skin cancer? In the panelist, yes, you just take an attempt. Means nothing wrong. You don't feel bad whether what we have known, what we have not known. That is not, and that is not at all a concern here. You just an attempt so that I will tell you how the students will also think. Yes, I give you an option also. I'll give you an option. Okay. The option which I am going to give you, option A, the question is this, the simplest factual question, the most common type of a skin cancer. Squamous cell cancer, basal cell carcinoma, malignant melanoma, and verrucous carcinoma. Now, you just type only the options, A, B, C, D, whatever the participants. This is how exactly your student will also approach. And the same way I will simulate and tell you. I want all of you to just press a key. It is nothing. Here, I'm not teaching you the subject. Here, I'm not to judge anybody's knowledge, but I'm just going to give you the template problem. But I need to tell you how it is given. I want all the participants to press the key. Some A, B, C, D, anything you press. Other panelists? Okay. Okay. Now, the most common type of skin cancer. Yes, the right answer. Yes, the right answer is basal cell carcinoma, correct? BCC. But don't worry about the answers here. Don't worry about the subject. We are not here to, because each and every one of you are from different specialty. I mean, that cannot be a common, knowledge base or a wisdom to take up any question. This is immaterial. And does not been required for a teacher also, I'm telling you. Knowledge in the subject has to be fine-tuned before every class. Yes, that's very, very important. You see, it's like a surgery, it's like any procedure that the day before you need to go prepared for that. That's very, very important. Now, the most common type of skin cancer is basal cell cancer. Yes, this is one level of question. See, this is the first level of question. This is a filler. If I give you the second level of question in the same, yes, most common type of BCC. If I give you this question, the most common type, if suppose you can take this as the second level, that is the B level. Okay. I can give you option as nodulo cystic or ulcerative, morphiac, number C, superficial spreading, okay, desmoplastic. Okay, if I give you these four options to you, nodulocystic, morphiac, superficial spreading, and desmoplastic, yes, what will you choose? The most common type of BCC? Yes, leave alone what you choose, because that might disturb you because it's oriented to the knowledge base. I'll tell you, this question is, the answer is nodulocystic. Understood? Now, the third level of question which I ask you, yes, the third level of question which I ask you in the same topic, yes, Mohs micrographic surgery is done for all the following except. And the same option as I have given us nodulocystic, morphiac, C is superficial spreading, and D is desmoplastic. This comes under category 3. So understand this. The same topic I can tell you. The most common type of skin cancer you answer is the basic filler. Yes, the answer is basal cell carcinoma. The second level of question is the most common type of BCC. Here, the confusion will come for what? Nodulocystic and superficial spreading. You understand this? The confusion will come between A and C. Morphiac, and most of the students will not go for desmoplastic also. But these two will have confused because this is something called fine tapping. That means fine tapping means what? In the entrance exam, it is an answer for one particular important and a famous topic could be correlated and extrapolated to the same allied topic. That means what I'm trying to tell you is the most common type of malignant melanoma is superficial spreading. That most of the students will know. Understand this. The most common type of malignant melanoma is superficial spreading. The minute a question asked in BCC, most common type of BCC, here also the examiner will purposefully give as a superficial spreading for a very simple reason, to confuse him. And even he has read as nodulocystic, he will not be able to confidently mark in an entrance exam in a stressful situation. That's how it is. Then it becomes logic and choose between two. That means nodulocystic or superficial spreading. In the mind, you'll say, which one to this, which one. Like that it will go. And the next level of question that is asked is, most of the BCC are treated by a Mohs micrographic surgery. That means it occurs in cosmetically more important area. That means this is called a BCC line. This is the angle of mouth and this is the tragus. So this is the line joining between these two is called BCC line. Any cancer happening above this line, the most common location for basal cell cancer. And that is a cosmetically more important area. So it is, the lesion is removed in millimeters margin under a microscopic guidance, and a frozen section is given. And according to the clearance, if it is clear, it will be stopped. Not clear, and few millimeters more will be added to the excision. That's what's called Mohs micrographic surgery. In a Mohs micrographic surgery is done for all BCCs except, I'm giving you the answer here, it is called morphiac BCC. The answer is morphiac BCC because morphiac BCC pathologically it has a subepidermal growth pattern. So if you do a Mohs micrographic surgery, the kind of recurrence will be more. So you have to do a wide local excision for a histopathological result of a morphiac BCC. Yes, morphiac type of BCC, you should do a wide local excision irrespective of the location. Either be cosmetically important or not important, it has to be done. Do you understand what I'm trying to tell you? Excuse me. Are you able to understand what I'm trying to tell you? I mean, I need your response, because this class, the workshop is driven, not one-way lecture. It is the both way. I mean, you can talk to me.
Yes, we can understand. Yeah, we can absolutely understand.
You want, see the examiners of PLAB or USMLE is different. The Indian examiners are tendency to tease the students. Understand this?
Yes.
Huh?
Yeah, that's correct.
It is not in between lines. It's in between words.
Right. Yeah.
See, in an USMLE pattern of exam, you will have a lot of clues from the question description, but there will not be any clue here. You know it, you don't know. I mean, you do or die. That's the exact way they give you the questions. Yeah. And so this is the example. See, any question has this 3 types of question. This 3 types. So we are talking about the fillers. If you ask me, sir, what is the consequence? Okay, of making a mistake in a filler. So we are talking about point 1, fillers. So I said, out of, say, let us take 200 questions. Out of that, I said, fillers could occupy 100 questions. And all should be correct. You can ask me, sir, what has to be correct in 100? 100, all question has to be right. Even one question is made by mistake, the student is out of the competition. Next comes logic. That means 50 questions, which comes for two options. To choose between two options. Now, in that, how many I should attend? I mean, you have to attend all the fillers and you have to attend all the logical questions. And in that, will I be in the competition or not in the competition? That has to be more than 90% has to be correct here. 90% has to be correct to stay in the competition. To stay in the competition. Next, the third one which I am talking about, are the difficult ones. The difficult ones. Okay, now this 50 questions. Yes, this question, making mistake of all the questions. All 50 questions are made mistakes. Still, it will not, no impact on the outcome. No impact, absolutely no impact. But what you should understand is, making 1 to 5 questions correct, it will compensate the losses. It will compensate the losses of mistakes done in 1 and 2. I'm telling you, 1 to 5 questions are made right. In the difficult ones, it will compensate the mistakes that are happened in this too. Because I am telling you, because 150 questions is 75%. Any exam, the first rank, there is 75%. Or the first rank could extraordinarily have gone beyond 75 to 80. But rest of the core group, that means from second rank or third rank till top 100, will lie between 70 to 75%. So there is a statistics behind what I'm telling you. It's not I'm just telling you blindly. Understand this. If 1 and 2 has been taken care properly, yes, you are in the game. You are in the competitive game. And understand, for the mistakes that could happen, yes, by, they say, a silly mistake I have done, without reading properly I have answered. Any of this have happened, 1 to 5 questions could compensate for the losses. Now, answering 5 to 10 questions correct, confidently he will be in the first 100 ranks. Provided they have done 1 and 2, what I have said, plus 5 to 10, they have made it right, they will be confidently in 100. Suppose they have answered 10 to 20 questions correct, they will be in top 50 ranks. And if they have done 10 to 30 questions right, they'll be in top 25 ranks. And anything more than 30 questions, yes, they are within top 10 ranks. Now, if you ask me, sir, for what we should train the students? Next question. it goes without saying that you need to train the student. All your students are going to take training under you, that you need to first train the fillers. That means you should capacitate them to stay in the competition, to write the exam first. Without knowing the fillers, they can't go for an exam. That means 50% of the paper they should know. They should read, understand. They have to. For that, you need to capacitate them. The knowledge that is required for that. The knowledge that is required for that. And the attitude that is required for that. And if you ask me, the most important is you should be a motivator first. The subject comes the next. So you should motivate a student to study. You should impress the student to study. And you should be a very, very, very strong orator. You should develop that skill. You need to motivate the student. That's very, very important. The motivation will work to go towards the dream. Yes? Because staying in a preparation for a competitive entrance examination is not that easy. The motivation has to, you can ask me, sir, when I should motivate? Before you start the class, you should motivate them. And you should tell them what is the importance of this. I mean, what is the benefit of this? And why should you do this? And you should connect them what they really like first. And first you need to tell them what is your interest. You need to identify what is their interest. And based on their interest, first you should engage them. And you should tell them, you should always see, a teacher has to be a role model. Understand that. See, if I have to train you, I should have undergone that, or I should not do it. See, in my experiences for past 20 years, and I have trained more than 3.5 lakh students. That means I can understand what he wants. If I'm not able to understand what he wants, I cannot give him what he wants. So that's very important. For that, first, the most important skill, if you're taking your notes, the most important skill for a teacher is first he has to be a motivator. First, you should understand that. That is the most important skill a teacher should have for himself. And he should be able to connect with the student. That is very important. Mentally, it is not by my presentation, it is not by my picture, it is not by my image, it is not by my personality or by physique. It is that I am able to connect to him mentally. First of all, what you need to ask him is, what specialty that you wanted to do, whether you want to do medicine, whether you want to do surgery, and why you wanted to do it. That's the first question you need to ask. And he will tell a reason for that. He will have a story, you will have a storyline for that. You need to first listen to the storyline. You should not just start a lecture because a class is given to you, as an opportunity given to you. There are students before you. It is not that you just go and start. Yes, that's the most common type of a skin cancer. The student, half of them will not get connected to you. It is not the subject that matters. It is a technique that matters. That's very important. Everybody has a subject. You tell me, without a subject, any university will give a qualification. Any university will give a pass. There's a basic standard subject that everybody has with them. The teacher who is taking and the student who is attending has the subject. But how the subject has to be handled is the matter in the entrance exam. How it has to be handled. How it has to be put in the right place. How it has to be put in the right way. So that is very important. So what I'm trying to tell you is, again, the first and foremost step. Yes, a teacher should have a passion to teach. That's the first. Yes, that is the basic inherent quality of a teacher that will come out. So if I put a ad that I am going to do a workshop, who will get attracted towards it? The person who is inclined to teach, and the teacher should also always be a learner. You understand, somebody puts a workshop for how to teach, I will also go and join. Understand this. So you should understand this. If somebody is going to, though I have a teaching capacity for 20 years, still I will not keep quiet. What I will do is, somebody is giving an advertisement, what I have given an advertisement like this, where you have joined. Somebody, if come across, I could find an advertisement. That means first I'll go and join for a reason that he's able to reach me. What is the technique he had to reach me? Yes. So that is the first step. So he is able to influence me. Teacher has to be an influencer. He should have a technique to reach. Today, in the advent of technology, you should have a capacity to reach to whom you want to do. So you would have made a product, but how to reach? That's an art. So we have to reach. So if I have to be a teacher, I have to be a learner. That means it doesn't become that I have become a faculty, an expert faculty, a national level of faculty. I will stop learning. No, I said, even a non-productive hours, I'm asking you to read the subject that you are inclined to or you are up to. And second, if somebody is going to tell me a teaching technique and I am going to conduct a workshop in a teaching technique, and I will go on attend because it's only 3 hours. And in 3 hours, he is going to give all his experiences. The minute he opens his mouth, a teacher cannot restrict by himself. There's a quality of a teacher. Understand this. A quality of a teacher, he cannot, even if he thinks, no, this I should not teach. If I teach, this is the core. And if I tell, everybody will know and they'll become like me. No, they can't become like you. Understand that. Only you can become like that. The number of productive hours that you have spent for the teaching, that hours matters. There's something called in pilot. They say it's a flying hours. I mean, a pilot teaches his co-pilot how to run the flight and how to drive a flight. He becomes a pilot. He becomes a co-pilot only. He becomes a pilot of that standard only if he flies this number of hours. So that's very important in teaching. So what I'm trying to tell you again, number one, a teacher has to be a learner. Only if he learns, he can teach. Okay. So I'm just putting the prerequisites for the teacher. Okay. So point number one, a teacher or somebody wants to become a faculty, he should have the enthusiasm to learn. Only if he learns, he'll be able to teach that. So he should be a thirstful teacher. That means he has to learn the teaching skills. Teaching skills is an art. It's art to convince someone. Only if you convince someone, you can take the product across and to give to them. If you don't have the art of convincing, yes, it's very difficult to transfer what you want to tell them. So you have to be a learner always. I'm saying the learner, this learning process has to be always. Correct? Now I'm talking to Dr. Kishore. He has a huge experience and wide experience, but still he adopts. What more I can learn from Dr. Vinayak today? That's the reason he has come. He didn't stop. Oh, I know this. I have taught so many people. I mean, is that adequate? No. I will learn something which I have not in practice, and this could add value to me, my teaching. See, that's how it is. So what can add value? Yes, today we have Dr. Aravind here, and Aravind says, I am in second year, I have a passion to teach, but how to teach? I mean, just I go and step in, and what Dr. Vinayak has undergone for 20 years, I have to undergo 20 years, and I'll become a teacher like Vinayak only after 20 years. Now, if I attend this lecture today, will I be able to learn what he has gone through for 20 years in a nutshell? I can implement within 1 year. So there has to be the practice, correct, Aravind? What am I saying? See, yes, you can't spend my 20 years time to learn and you become like me after 20 years. You should become like me, yes, in 1 or 2 years. Correct? Why you need that learning experience and learning curve? You learn from someone how to learn, how to do it, and you practice what the mistakes, what we have done earlier, you don't do it. And what are the plus that we have done? You adopt it into your teaching skills and you become like me from day one or from probably 6 months to 1 year now. Correct? Say yes or no? Hello, are you there? Is Dr. Aravind here?
Yes, sir.
Or you left? Is the session boring in the morning? Okay. So I want rest of the people also to get connected. I mean, Dr. Shilpa, Dr. Dharnidharan. See, what I have seen is the number of people who have shown interest to learn. I want to become a faculty. Everybody wants to be a faculty. They say, I want to be a teacher. I want to be a teacher. Yes, of course, you want to be a teacher. But how you become a refined and a fine teacher? Somebody, you go on a podium, you just take a podium and you hold it, and the minute you start, yes, that aura should come. Wow. And somebody who is going out of the hall, once the minute you step in, they should come back and sit there. And the minute they see your name, suppose you go to a pedicon. Now pedicon is happening, where is it happening? You tell me. See, the pedicon. I'll write if you can't hear me properly.
It's okay.
Pedicon. No, you come in the, see, pedicon. Yes, 2023. Where is it happening? Where is the place?
So it wasn't Trivandrum once?
No, this year.
Don't know, sir.
See, that's very important now. A teacher has to be connected. Don't find me, I'm not, you should take this as a very close forum. So what I'm telling you is Pedicon is happening in Gujarat, in Ahmedabad. Yes. And it started today. 19, 20, 21, 22, 23. 5 days. That's your pediatric conference. Annual conference of pediatrics has started today. Okay. So why am I telling you this? Because in second year, they will generally allow for a pediatric conference. Or third year, they allow you for a pediatric conference. For annual national conference. So you have to go and attend. Because in a conference, there will be different varieties of presentation, different varieties of teachers who will come and present. And you will have an opportunity to listen to them. And you will find different ideas. And the collective idea of all that could make one master presentation at the end of the conference that if you could observe very keen. Understand that? So you need to be connected with people. That's very, very important. You need to go for good lectures. You need to attend lectures. And that's very, very important. So teacher has to be a learner. He has to be a learner always if he wants to teach. If he wants to retire, stop learning. So he has to be learning on daily basis. And you can ask me, sir, learning on what? You have to learn daily basis. How to learn on daily basis? You need to learn at least 1 point more than what you have learned yesterday. One extra point that you should know. Today you have learned something. Okay, fine. That is gone today. Tomorrow, I need to learn something more. You can't just stay where you are. That is the quality of a teacher. 1 point you need to learn. One concept, 1 point, one fact. Something you should learn daily. So, you just understand 1 point, one concept or one fact daily. 365 concepts you have learned in 1 year. And that is going to be a value that you have added to yourself. Understand? This has to be a conscious intake. Understand? I'm telling you, it is not just you go to a college and you are a resident and somebody is teaching you. I'm not talking about that. That is a passive learning. What I am talking about is your effort to learn, conscious effort to learn 1 point irrespective of somebody is giving to you. Yes. So one value has to be added every day of your subject, of your teaching skills. That value could be the methodology to teach that today you are adding a value, I'm telling you. 100% at the end of the day, the perspective that you have come in and the perspective that you will go out will be different, I know. So you have added a value today. This value I didn't give you free. I thought if I had thought it's a free workshop. If I said a free workshop today, I didn't give you free. I charged you 4,800 rupees today. Why I charged you? Because I wanted people who are very serious about it. So do not engage. The next lesson I am teaching you is do not engage people who are not interested in teaching. So what I'm going to add now is going to the next step which I'm adding here is 1 point you will learn and 1 class a day you should engage. That means you should take 1 class minimum per day. You should find an avenue. Let it be an online or an offline, whatever it might be. Yes, you should engage yourself to teach something, 5 minutes or 10 minutes or 15 minutes. Some teaching. If no student is there, yes, you just take a video and publish in your YouTube channel or on your Facebook. That means you have taught to the universe. Suppose you teach to 1 or 2 students, you have taught only two students. But if you are teaching that you publish in YouTube and in the Facebook, the social media, you have taught the entire universe. That means the people related to your topic have been taught today. Finished? Chapter closed. So what is the prerequisite of being a teacher? He has to be a strong learner on daily basis. He has to learn a teaching skill or a subject knowledge has to be there on a daily basis. Number 2, he has to take a class. Yes, it could be even a 1-minute class. I'll tell you why. What is the importance of it? Because that you could deliver to someone can't be defective. It will be error-free. That means you are consolidating that what you have learned, that 1 point that you deliver. Suppose you deliver a point that's with a mistake. People immediately will comment, this is rubbish, this is wrong. What you're saying is wrong. So you will have a challenge to commit an error there. So you will deliver. If you have an audience, you deliver. If you don't have an audience, you deliver that in your YouTube or a Facebook or social media. You can ask me, sir, do you learn, daily? Do you deliver lecture daily? Yes, I do. That means if you teach, the third point is you practice. What are the inherent qualities of a teacher? Number one, the interest. The basic today, those panelists who are attending my session today, they have a very keen emotional interest to be a great teacher. I'm telling you today. That is the most important prerequisite because you have added, because you are paid for it. Payment is not for the money. Payment is for the commitment. That means, that is your effort. Money is effort. To earn this 4,800 rupees, a considerable amount of effort you have put into earn it. And that you are willing to spare and your time. So money and time, both are important to invest. And if you invest, that means you are serious about this. And if you are serious about this, that is the inherent interest. But that has to be built. Capacity building has to happen from there. See, that is the basic. You being in the game is number one. And once you are in the game, what are the capacity building that you need? So that's what we are doing today. So practice. That means what you preach, you practice. That means you ask me a question, sir, do you teach every day? Of course, yes, I teach every day. There's not even a single day which I have not taught. Every day I teach. And every day I learn. Every day I learn. So this has to be simultaneous. So this, number two, I said you should be a motivator. You should learn the capacity to motivate. That means you need to read or listen to general aspects, how to motivate. You need to simulate. You need to tell stories in the class. You need to relate your subject to your clinical experience, the outcome of the clinical experience. So you need to keep motivating the student. Keep motivating a student. That's very, very, very important. You need to not to start the subject straight. And again, I'm reinforcing that. You need to get connected first. You need to get connected with the student. And I used to tell this story. You just listen to the story. When I motivate the student in the motivating class, I used to say, doability. This is very, very important. The student will ask you a question. Will I be able to do it? Will I be able to do it or achieve it? See, you ask a question to a student. What do you want to become? He'll say, sir, I'm interested in MD radio diagnosis. I'm interested in general surgery. I'm interested in pediatrics. And I'm interested in orthopedics. But sir, the good number of seats that are available are top 500. In that top 500, top 100 gets good institutions. Will I be able to do it? And he will ask you his difficulties and deficiency through you. What you will ask? Sir, I studied in a private medical college. My father paid 1 crore for my MBBS seat. What chances do I stand to pass this NEET exam or upcoming next exam, to clear it and to get a merit seat without any payment? This is the question that all of you as a trainer will face tomorrow. That means he will ask his ability to achieve. You can tell, I am a good faculty, I am a good teacher, I have this capacity, I have taught so many hours, so many students, I help them to pass, and all the capacity that I have to build you. But he will ask, what capacity I have? See, first I said capacity building of the faculty, and faculty has to be a motivator. The question of all the students I'm telling you today, any student, irrespective of the category they belong to, irrespective of the course they take, the course they want to prepare, they will ask you this question: do I have the capacity to achieve it? Do I have the capacity to achieve it? Now, for this, if you say you have the capacity to achieve it, you will not be, you will not take it that way. He can't. That will not suffix his question. If you ask me, if you ask, Dhanidharan asked me a question, sir, do I have a capacity to become a great teacher? If Dhanidharan, if I say, you are a greatest teacher, if I tell you, you will laugh at me. You'll say, sir, what is this answer for my question? That means it is just a superficial answer, correct? It's a superficial answer. Of course, you will become one day. I'm not saying you will not become. You will become. But if I say just in a face value of what the question you asked, that will not work actually. That will not work. That
Yes.
has to be connected with the reality. That has to be connected with the reality. So for that, you need to tell a story, and the story has to be real. Because today the student will understand if you tell a story is a true story or a made-up story, the student will understand that. So you need to share a true story. That means you need to identify a true story and you need to be a part of the true story. Yes?
Yes,
So,
correct.
and over years, that story building will come in place. So that is very, very important. So this question was asked to me by one student, sir, I failed in pediatrics for one attempt. I failed in surgery for 2 attempts. You tell me, am I eligible to write this exam only? Yes. I mean, if I just clear the NEET exam, my father is saying I'll pay the fund for what you wanted. And my interest is radio diagnosis. My father says, just to clear the NEET requirement, just the pass, I will pay whatever the fund required for you and to get to the seat. He said, excuse me, boss. Today your father will pay. He already has paid for your MBBS. Now he will pay for your MD also. And he will go and sit outside the scan center. And he will buy your MRI, CT, everything he will buy. He will sit outside the scan center. What he will tell, see the father's attitude, I'll tell you. Because I am also a father today. The father's attitude is, what he will say to the patients who are coming outside and the visitors who are coming outside, I brought MBBS seat for 1 crore to my son because that is his achievement. And I purchased another 1.5 crore to get an MD radio diagnosis. Then I have spent almost 10 crores to get a CT, MRI and ultrasound and echo machine and develop this hospital. My investment for my son, yes, with my hard work, is 25 crores today. Yes, 15 to 25 crores, which is my investment on my hard work. Of course, yes, 100% truth. His hard work, his investment, his money, he has made up his son. That's what he will talk. I asked, is the way that your father want to talk about you like this? I asked this question to him. See, if you don't get a seat on the first attempt, yes, what will happen? Nothing will happen. The second attempt, nothing will happen. Third attempt, nothing will happen. You get even the fourth attempt, you're going to read, right? But till the end of your life, the people will keep saying you that. Your father, not others, your father will say. If suppose someone reads your citation in your conference or in your gathering, he has done MD radio diagnosis in All India Institute of Medical Sciences, intervention radiology in PGI Chandigarh, and a fellowship in radiology in Royal College of Edinburgh. Somebody reads a citation, even before you deliver a lecture, people will know who you are. So now what are we telling him? That you need to achieve things by yourself to earn the respect. So what are we telling the student now? Only if you achieve things by yourself, you will earn the respect. In medical practice, your father cannot come and handle the complications. Your father cannot come and write the diagnosis. Your father cannot come and write the inference. That how he will purchase. He will purchase everything for you. Can he purchase the clinical skills that are required to practice? He cannot. So there is a limitation. So you need to tell them this. That means even if your father is capable of purchasing something for you, you should not accept. That's the first inference that you need to put across them. Yes, though you have a capacity to do it, that doesn't mean that you can do it. Yes. So I'm just telling you a story right now. I'm just going to complete. I'll give a break shortly. So that here it ends, that about how the requirement of a student, how a requirement of faculty has to be there. Now, his name is a student name is Santosh because he's an achiever. I'm sharing his name today with you. And he had the same difficulty that he said the difficulty for him. I don't find a difficulty. For me, any student from years past his MBBS is same to me, irrespective of where he's passed his MBBS from. Whether it be in a private college or a government college doesn't make difference at all, because that MBBS knowledge is the filler 100%. But what is going to decide the ranking in this entrance examination is the skill that you're going to learn post MBBS and in the techniques to learn in the competitive for the competitive entrance exam. So I told him this: whatever you have told that you are from a private medical college, I failed twice in surgery, once in pediatrics. I mean, will I be eligible? I said, you're the most eligible candidate. He asked me, how, sir? How will I be the most eligible candidate? I'll tell you. The best student you ever have is he himself considers a weak student, or everybody considers a weak student is the best student for a faculty. Understand this today. The third important point I'm telling you today is the third important point. If a student says weak and not good in subject, whether he says or his friend says or the entire system says, he is the best student ever you can have. I'm telling you this today. This is the secret. This is the most important secret, that is, people will discard a student from the system. He'll say he's the worst person. He does not read, does not know anything. Yes, he's the best. I mean, I will take up only those students with the topmost priority. It doesn't mean that I don't take others. This I will take them with the topmost priority. He'll say I'm the backbencher. I don't fit into the system. You'll say all this or the typical sayings, because once you fix this kind of a student and once you start adapting to this kind of student, that means rest of the requirement will automatically be satisfied. Understand this. You understand what I'm trying to tell you? If you fix your way and methodology of teaching to satisfy the weakest student that he himself considers, no teacher will consider a weakest student. And you should ever attend this word to anyone. You are the weakest. You don't know anything. It is not way. See, teachers should never use negative words. Understand? See, in my lecture from the morning, I have never ever used a single negative word to you. My class is all about energy, all about enthusiasm. 2 E's are very important. The entire lecture has to be energetic, like a Rajinikanth's movie or someone's movie you consider that worth watching in the first day, first show. That means the class has to be highly energetic and enthusiastic. If you are not energetic and enthusiastic, and how you can create for the students who are achieving it. Understand? So what I'm trying to tell you is, the weakest considered student by himself or someone else, not by us as teachers, is the student of choice. Should be there. Because once you fix in a batch, suppose there's a 15 in a batch, you fix this student first. Don't fix a topper. Understand, don't fix a topper. The best student don't fix. Because topper will not listen to what all you say. I'm telling you today. The person who is knowledgeable will take only 5% of yours. What he will take, what he will take. The things that he doesn't know, that you are saying, only that he will take. And he will not be your 100% student. Your 100% student will not be a brilliant student, considered brilliant, the best outgoing, the brilliant student will not take everything from you. He will take what he wants. He would have had a filler by himself. That filler, on top of the filler, what he wanted only he will choose. That means he will go to a buffet and he will take what he wants. He does not want filler. Yes, he wants only leg piece. Okay, he does not want biryani. He does not want the rice. He wants only the leg piece. Yes, and he will not appreciate 100% on the results. I'm telling you today. He will not appreciate 100% on the results, because what he wanted only he has taken. And the teacher is not responsible for his results. For a weaker student, you will give him the filler, you will give him the logic, you will give him the updates, and he will be 100% dedicated to you. And he will say 100% what you say he will follow. And 100% he will deliver what you said in the exam. And he will give you the results. Because a topmost guy, so this I said on one end, I said it is a weak, on the other end is a top guy. The class, correct? And weak, you said, is the wholesome meal. That means he will take all A, B, and C. And he will perform exactly what you said, because he has totally believed in you. And it is like you are writing the exam for him. In short words, I am telling you, for this student, what I am talking about, the weak guy, and you are appearing his exam. You are writing his exam through him. And this top guy, he is writing the exam and you are not writing the exam. You have added 5 to 10% of the value that you wanted. And he will have the same description attitude. Yes, same attitude in writing the exam. And exam also you will not believe. The question also you will not believe. He will say, oh, he is given like this. Probably you might have thought this. So he will put that idea in every question. And in the first attempt, you will not clear at all. Understand the story. A brilliant and a best outgoing student will not clear in the first attempt. He will not clear. He will not get a good rank. After 1 or 2 exams, he will understand the mistake that he have made. That means he has into every aspect of the question. He will not take the face value of the question. See, in entrance exam, the most important is you need not go deep into it. You need to understand what really it is asked, as in the face value. You cannot go one step beyond. This exam is this. Suppose the next exam can't be of low standard like this. And they should not ask this question. So there will be something behind this. So only because of they have asked. So I will go a step behind and I answer. That means there will be a mistake there. Or a weak student will say, my teacher has only taught me this question, only this answer. Beyond that, he does not have a knowledge to think. Understand what I am telling you. Beyond that, he cannot think by himself because he will not have a knowledge to do so. So the most important requirement of a student does not need to know much. He needs to know only to clear the entrance exam, because entrance exam is about all the 19 subjects. He need not be a master of all 19 subjects. He need to know the subject and techniques that to clear this exam and to go into a specialty and become a master in the specialty. Why he need to make a pediatrician before he become a pediatrician? He has to just clear the pediatric question, right? He need not have a knowledge of what Dr. Aravind has. Yes, he need not know the entire pathology what Dr. Kishore has. He needs to only have the knowledge and the capacity and techniques to clear only pathology questions. Only that we need to deliver. It is not that we need to deliver and tell him everything that to learn. That is not going to work. So I am telling you, what am I telling you? Where we started. We started with a teacher, faculty. Faculty has a very keen interest. I said, as that only will drive to become a faculty. And he has to follow certain techniques, which I have told you, to be online with teaching capacity. And then is to be a motivator. And then is to motivate his students. That's very, very important. So these steps has to happen in preliminary area. So I was talking about a story that a weak student, he himself declared, I'm universally weak. I don't have any capacity to achieve. I surrender everything to you. You tell me what am I supposed to do. So for this student who is interested in, but he is interested to do radio diagnosis, I'm telling you. And his interest, I asked one step ahead, where do you want to do radio diagnosis? Sir, people will laugh at me if I tell you. Even yourself, you will laugh at me if I tell you. I want to do MD radio diagnosis in All India Institute of Medical Sciences. I said, it is quite achievable. Why not? You have become an MBBS, post-graduation, want to do MD radio diagnosis and you want to do in a good institute is a normal phenomenon. It's nothing great. You didn't ask me, I want to become the Prime Minister, the President of this country. Even that you work on those lines, you can become that way also. That is different, totally different chapter. But what I'm trying to tell you is, these are something which are achievable. See, there are certain things which are not achievable, not possible. These are certain things achievable. This is a normal student who wants to do, he can do it. I motivated him and I made him to read what he's supposed to learn and prepare oneself. Two important things that you need to do for students before you start your subject. Number one, first you should understand the requirement. What is his dream? What he wanted to do and how he got it. He will tell some story. Sir, when I was in my clinical posting and there was chief in pediatrics, the way they started treating the children, the way they handled the child in the neonatal ICU, it really gave me a great interest in this specialty. Then I understood there is a pediatrician in me. Then I want to do that. He will say that. If you want to be a surgeon, sir, I went to surgical OT and one of the clinical posting. The way the chief did the surgery with a style, the way he handled the patient in the rounds, and I saw a surgeon in me, then I want to become a surgeon. He will have a story. Every student who wants to do something will have a story, who inspired. So that you should first listen to them. Then after listening to it, then what they want to achieve, we should know what is their dream and capacity building to achieve their dream. This is what a teacher's job is. So without knowing this, you can't just blindly start something you wanted to do. So once you have understood what they wanted to do, and you should motivate them. And the motivation story which I am going to tell you right now for what I said the student will simulate. Now this student I motivated, and 2 months are over. The student was in connection to eye to eye contact. So whenever a teacher, you need to, because in online class is very difficult, but online class, the video or the chat, the enable, you need to be in contact. In a physical class, if you handle, you need to have an eye to eye contact with the student. And you should know what they are thinking. You should understand, and that skill you will develop over a period of time. Are they listening to you? Are they not listening to you? What is running in their mind? If you say something, they are responding. That means you need to increase your level of teaching. So those things, as you handle classes, you will get to know. Now, this student, 2 months of class are over. After 2 months, his father came, and Santosh said, "My father has come, sir. He wants to meet you." I said, "Okay, fine. Ask him to come during my lunch break. I'll meet him." And in the lunch break, and this was in one of my classes in Bangalore, in Good Shepherd's Auditorium in MG Road. And his father, Santosh's father, came and said, "Sir, your classes are very good." He was appreciating me a lot. Said, "Your classes are very good. My son Santosh is high, placing a high value for you and for your classes, and high words and high appreciation. We really great to have a teacher like this." He was talking to me like this for 15 minutes. Then I thought, this is something abnormal. I don't just entertain. Few words okay, but so many appreciation is not too good. That means something is behind it. Then I asked him, "Okay, sir, what I can do for you?" "Sir, my son wanted radio diagnosis." Probably he might have also told you. Yes, I know he is interested in radio diagnosis. "Sir, one of my private medical college, the chairman is known to me. I have got a special discount because my known connection. He has given me 25 lakhs of discount." I asked, "What is the price?" "Sir, 1.5 crores, sir. 25 lakhs discount he has given me. 1.25 crores is enough for me to pay." "Okay, what should I do for this?" "It's your wish. You want to make your son admit there? I don't have anything." "So what do you want from me?" "Sir, refund, sir." "What refund?" "Sir, my son has paid 25,000 rupees course fees to your institution, and 2 months you deduct 5,000 to 6,000 rupees. Rest of the money you can give to me, I will go." You see the logic behind it. That is 1.5 crore is the tuition fees. 1.5 crore is the tuition fees of the radio diagnosis seat of MD, and he is sitting for 18,000 rupees refund from a teacher. See, this is how they will simulate. See, they will think this is a waste of money, and the expenditure spent on, yes, on capitation, they will think there's a seat which is achieved through that. Yes. Here, there's an important point. You need to make the student understand. Now, what I did, "Sir, give me 5-10 minutes. I will talk to Santosh and I'll process your refund," I said. Then I asked Santosh and I told him what I told you. You want to be a father's son or achieve by yourself? Immediately, father started shouting at me. He was pricing me for 10-15 minutes, and after that started shouting at me. "Don't talk to my son. You will confuse him." See, "Don't talk to my son." See the words. Typically how the patient attender behave in a hospital. "Don't talk to my son. You will confuse him. I don't want to talk to you." Santosh said, "Sir, he is my teacher. I have respect for him. Why can't I talk to you? Talk to him. I'll talk to him and come back to you." He told his father. Then I told the same words I told you. What are the prospects of doing in a private medical college and a private setup to acquire this seat and to present in later part of his life? He was totally convinced, and he said, I've started my preparation. So you need to have built this relationship. You have built a relationship only with the subject. He will not stand for you. what your words. You have to build a relationship beyond that. Only then, that means you are really and seriously concerned about his outcome. That is very important. It is not an artificial thing that you can build up. That will not work. Emotionally or whatever, mentally, nothing will work. He has developed I know him only for 2 months, but he knows I am talking truth to him. I am talking for his benefit and real benefit long term. Then he said to his father, no, I will follow what sir says. I don't want any private medical college seats. I will work by myself. Chapter closed. Now more responsibility on me because I have taken him out of a seat. I mean, it would have been his responsibility and his father's responsibility to get him a seat. Now it's my responsibility because I have motivated him to carry on with his course. Now I was very, 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 very serious with him. I was very, very, very keen that I used to follow him regularly. I used to see to that he has learned something every day that he has to perform. And it is my challenge. And he considered himself as weak. I don't consider him. He himself considers weak. Then somehow or other, yes, I was able to get him into All India Institute of Medical Sciences. He got ranked number 24 and he could not get MD radio diagnosis. I'm telling you the fact today. Then he wrote the next PGI Chandigarh. At the time it was not INICET, it was separate exam and before INICET era. And he got rank number 11. Again, he could not get MD radio diagnosis there. And in an All India exam, yes, national level exam, he got ranked number 92. He was able to get radio diagnosis any of the good college. But see the irony, he didn't go for the counseling. That means I don't want seat in All India ranking. 92 I am able to get, but he has tasted rank number 11 in PGI, rank number 22 or 24 in AIIMS. That means he's in the firing range. He has been into the system now. It is just 1 or 2 questions that has made a difference. Subsequently, he wrote All India Institute of Medical Sciences. He got rank number 2 and PGI rank number 5. Both the places he was able to get MD radio diagnosis. Then finally, he chose All India Institute of Medical Sciences after 1 year. At that time, he came back to me along with his father and he gave the mic to his father and father said, 2 years back, if I would have taken a decision by myself, my son would have been studying the 2nd year in a private medical college. But it would have not made a difference for me to get a merit seat and my son has achieved by himself and I am proud of my son. And the teacher who motivated Dr. Vinayak Senthil, I am very, very thankful to him. So now we have convinced his parents and father also. Understood? So this is what it's all about a teacher about. So I have given something which is very, very wholesome. That means I have given you something which is the experience that I have shared with you. And when these things are adopted, yes, I mean, people will generally talk about acquiring teaching skills, acquiring technical skills that we will do simultaneously. There is a routine. But these are very, very, very important. What I am telling you today is handling. You have to handle. See, today, any response which comes to me individually. N number of students. I attend each and every query. Yes, if someone messages me today, I see the message, I will not type. Instead, I put a voice call because there he'll be able to hear my voice. He'll be able to listen what I'm feeling about him. If I type something, routine emojis, routine claps, routine thumbs up will send. If I talk to him, he will be more motivated and become more energetic. I always use this. That means if a question comes for answer, I put a voice call to him, voice message. And anything that he says, I've got this rank, I will not put congratulations, best wishes to you for all your future endeavors. I don't type. I talk to him. Whatever I want to say, I talk to him. Or I'll just call him and talk to him. That means I'm just going to give a break of 10 minutes. Before that, I'll tell you, the most important and a great teacher is to handhold the student. The minute as there's a student with you, you need to handhold him and take him the entire journey along with you until he reaches. where he's supposed to reach. Yes? And for that, there is a relationship that to be created between you and the student. Yes? And that relationship has to be very, 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 very strong. And so that with that relation, you will be able to deliver the knowledge that you want to, the techniques that you want to, and you can motivate him, and you can make him achieve his dream. Yes, once you started following this circuit, yes, and the results are great. If someone says your results are great, because only through this the results are great. Okay, I think we'll take a short break of 10 minutes and we'll be back. And in the second session, what I'm going to teach is and tell you is how to prepare a subject, how to prepare and how to deliver. And what delivery and on what way it is delivered can take the subject into short-term to long-term memory. Short-term to long-term memory. If most of the things are put across, I told you a story of Santosh. Now, this story of Santosh will go straight to long-term memory. Will go to long-term memory. I said the most common type of skin cancer. And most of you said it is basal cell cancer. Yes? You would have answered which is there in short-term or long-term as a correct answer. And those who are learned today, the most common type of skin cancer is basal cell cancer. And the most common type of basal cell cancer is nodular ulcerative or nodular cystic. That will go only to working memory. That will go only to the working memory. Working memory is what you just receive and it does not have any storage. It is just what we receive. So I'm going to talk about the memory system that you need to handle and what level of memory you are going to sit in the student's mind. That's very important. So that can make an impact. So if you put a concept, if you can put a fact in the long-term memory, he need not revise at all. See, the most important success in entrance examination is revision. If anything in a long-term memory, no revision is required. Anything in a short-term memory, revision is required. So I will, my techniques, next what I'm going to tell you is, everything you can't put in long-term memory. That means, there are things that can put only in short-term memory. There are things which can put only in working memory. There are things which can put in long-term memory. But how to relate? Student can be able to relate things from that you teach, that through long-term memory you can take, and from the short-term memory that you'll be able to recollect during the exam and to answer. So that is very important. So for that, what kind of presentations are required? How to take it across so that, see, in those days you would have also experienced. You would have written an exam, an MCQ exam, and only those questions which you felt, I want to go back after the exam and I want to see the book and I want to see whether I answered it right or wrong. Only those questions you will remember immediately. And those questions, once you remember immediately, you will open the exact page immediately, and in your brain you will say right hand side below this image, this point is there. That page also you will open immediately. Then you will see, oh, this is what they asked. My God, I made a mistake. Like that you will feel. That means page memory. This is something called page memory. This table there I read page memory. Is the page memory more effective, or a student attending a class, that memory is most effective? That is what we are going to discuss in the upcoming session. Okay.